exciting areas where I believe the field is taking off in the future will be the use of mobile phone and tablet-based technologies as well as virtual reality. Mobile phone technologies can provide a critical link in between patient visits and also allowing the clinician and the patient to monitor their symptoms, be it anxiety or mood, on a daily basis or even an hourly basis. One exciting area is in substance abuse. If we have a patient that is really having difficulty with craving and relapse, we can use geofencing on their phone to potentially highlight areas where this patient has relapsed before. And when their phone gets within a certain distance, the phone could pop up an assessment tool, could provide them with a message telling them they're near a high-risk relapse situation or area. Also, they could phone their sponsor or even have a link back to the clinic. So cell phones can provide valuable data at that critical time in between clinical visits and support the patient, but also provide clinicians valuable information. The other area is virtual reality. We've heard about virtual reality for many, many years, and now it's often commonplace. You can see it on cell phone-based technologies or in even portable headsets. Virtual reality can be leveraged not only to do assessments, but also to provide valuable ways to bring the environment into the clinical space. Again, in substance abuse or in anxiety disorders, we can bring situations into the clinical space and work with the patient. So for example, in anxiety disorders, if we have a patient that has a fear of heights, we can bring a realistic heights-based scenario in and practice exposure therapy in the safe clinical space. We can then, after several sessions, allow that patient to continue practicing at their own time in between sessions so we can really reinforce the skills. So these are two areas that I believe are really going to shape what we do in clinical practice and also for patient care in and outside the clinic in the next 5 to 10 years. As we see emerging technologies, be it virtual reality, computer-based assessment systems, or even mobile-based technologies, some of the key factors that have limited widespread use is often clinician buy-in. Many times technologies are developed without clinician feedback, and if it's added into our practice, and it makes practice cumbersome, it adds additional time to the visit, it takes away from the clinical practice in any way, that's going to affect the adoption. What we really need to do is work with clinicians and practitioners as we develop these technologies so they can seamlessly integrate in what we do, be it an assessment tool or something that we may be leveraging during a therapeutic session or having our patients use in between visits. But the key is developing these with clinicians in mind to get buy-in as we go forward. So again, to get clinician buy-in, we need to have clinicians be at the forefront of developing these technologies and working with leaders in the field. And I believe that will be the best way to adopt technology to support our patients and practitioners in the future. Out of all the things we've discussed with technology, accessibility has to be key, fairness and equity in whatever we develop. The pandemic has shown us when we think about, for instance, schools or even accessing doctors via the internet or doing some virtual visits, technology disparities still exist on incredible levels, and we've not solved that issue. That's got to be a key factor going forward to create equity and fairness and access. Health and behavioral health care are human rights, and that is my core belief system. So I believe with technology, be it cell phones, be it desktop-based or even virtual reality, anything we develop, starting from the very core of our development phase, we have clinicians involved, as we've discussed previously. We also think about access, that it's not just for people that can afford high-dollar treatments and effective treatments. It should be open for everyone. Everyone deserves effective treatment. So we can really leverage and think about how we take technology to solve problems, but make it accessible to everyone. And that should be our goal.